All right, hi, Paul Slatkus. I'm speaking with Dr. Michael Natter. Hi, doctor. How are you today?
I'm doing well, Paul. Thanks for having me.
Endocrinologist here. We're going to talk about diabetes, type 1 diabetes. It's on the rise here in America. 1.24 million Americans live with the disease, and they expect the number to grow to 5 million by 2050. And type 1, you hear a lot about type 2, but type 1, I don't really know exactly what that is, but I do know, and it says here that you got it when you were 9 years old. Is this right? Do I read
Correct.
this right? How'd that
That's
happen?
correct. That's correct. Yeah. Yeah.
Hereditary?
So thanks, Paul. Sorry.
Is it hereditary? I'm sorry.
No, it's okay. That's a great question. So type 1 diabetes, first, I should also say, as you mentioned, so I was diagnosed 2 weeks after my ninth birthday. And type 1 is very different from the other types of diabetes. It is often diagnosed in childhood, but can be diagnosed at any point in time. It's an autoimmune disease, a chronic autoimmune disease. And so what does that mean? So auto really means self, and immune is your immune system, like your army that attacks things like invaders, like viruses, bacteria, those types of things. But when you have an autoimmune condition, the body kind of goes haywire and it attacks itself. So the beta cells, the insulin producing cells of the pancreas, get attacked and it renders them basically useless. So there's no insulin at all in the body. And that would require insulin therapy through injection or insulin pump, really for the rest of someone's life. And as an endocrinologist who treats folks with type 1 diabetes, I really understand what they go through because I do it as well. So it's made me a really empathetic doctor, which is something I cherish. But I do also want to mention that with type 1 diabetes, it's not uncommon for folks to get diagnosed kind of later in its progression without knowing. And that leads to a higher possibility of a life-threatening complication that's called diabetic ketoacidosis, or DKA. And because of that, I really wanted to encourage and educate folks to talk to their doctor about getting screened for type 1 diabetes.
Okay, so how do you get screened for type 1 diabetes?
Right. So it's important you talk to your own physician. But when you talk to your physician, the way that one would get screened is through a blood test. So the blood test is checking for something very specific called an autoantibody screen. And those autoantibodies that are known in type 1 diabetes, if they were positive, it increases the likelihood and chance that someone will eventually basically develop type 1 diabetes. And the advantages of doing so and getting screened early are because you might not have any symptoms. And you can pick it up so early that without requiring insulin or without having any symptoms at that stage, allows you to really learn and educate yourself and kind of equip yourself and prepare for what's to come down the road.
What's A1C?
And
Do I have that
A1C is
right?
so a hemoglobin A1C is actually a blood test that checks a 3-month average of blood sugar that is kind of the gold standard for kind of monitoring diabetes. However, I will say that what I'm really here to talk about today is screening for type 1 diabetes, which is very different from A1C. It's the idea of seeing if there's autoantibody positivity in the blood.
Okay, because you hear a lot about that as well. So let's talk more about the type 1. Um, so in this blood test, what will some of the results potentially show us? And are there numbers that you shouldn't be less than or more than, or how does it work?
Yeah, so there's a number of autoantibodies, but this is something, the details of which you should really talk to your individual provider and primary care doctor about. But effectively, from a patient perspective, you're going to get your blood drawn. And the results of that blood will tell you if there's autoantibody positivity, and your doctor can then walk you through what that means. But effectively, if there is that positivity, it does increase the risk that you will eventually develop type 1 diabetes. And that's something that we like to try and pick up as soon and early as possible so we can avoid the risk of potentially getting diabetic ketoacidosis, which remember is that life-threatening condition. And we know that early screening can actually reduce that risk by up to 50%.
Some people get that the DKA, was it, and then find
Correct.
out that they actually had type 1 diabetes? I mean, there's something happened to you physically, and now as a result of that, they figure out that you have that. Then they figure out that you really had type 1 diabetes because you never took care and looked into it.
Yeah, that's part of it for sure. So, I'm actually a great example of that. I went into DKA when I was 9, and that's how I presented and realized I had type 1 diabetes. I had to go to the hospital. I had to be hospitalized. It was miserable and very scary. But it's not always the case in how someone will present. There's a number of different kind of signs and symptoms. However, what we really want to educate people about is the fact that you can talk to your doctor about getting a blood test with no symptoms present, and that can help kind of gauge a risk for developing type 1 at some point in your life.
I go to my doctor, I take these blood tests all year long, it seems, because I think it's the wisest thing you can do because they have all those panels for so many different concerns just from taking a little blood test. And by far, everybody should have an annual. What's this One Pledge movement? What's that all about?
Yeah, so I'm actually really proud to be engaged by Sanofi as the spokesperson for their One Pledge movement. And the One Pledge movement is all about type 1 diabetes awareness, education, and early screening. And there's a fantastic website, theonepledge.com, where you can learn all about the different facts about type 1 diabetes, but also about the screening process that we discussed. And again, it's always, always, always most important to talk to your own doctor about all of this as well.
I love that you're strong on doctors. And to find a good doctor is a good thing. I'm in New York, so
It's hard sometimes, I understand.
well, we're lucky here in New York, I would say, because New York we have lots of doctors, lots of great hospitals, and a lot of great medical care, yourself included. Do you have to take insulin
Thank you.
every day to help yourself here since you're 9?
I do, Paul.
Wow.
Yeah, since 9. Yeah, so I started on injections and now I use an insulin pump, and it's the management has come a long way. But again, it's so interesting because learning how to take care of yourself is very difficult. And you can imagine if you're diagnosed in the middle of a crisis and trauma of having diabetic ketoacidosis and those kinds of things, it's almost more difficult. So again, if that early screening helps detect it before there's any symptoms or any complications, it really puts you in a good position to really learn, understand, and cope with what it's going to be like to have that chronic condition.
What's the One Pledge? What actually is that movement? What do people do? They sign up, or they have meetings, or what is it all about?
Yeah, so I want to direct everyone to the website, honestly, because it talks all about it. But it's the idea of pledging to get screened and to kind of educate everyone about the fact that you can get screened for type 1. So again, I do want to talk about the onepledge.com is the website. Highly recommend people check it out and take a look.
Okay, Dr. Netter, thank you so much for sharing this important news. Anything else you want to share with us at this moment? Am I
Yeah, thanks,
missing
Paul.
anything? You're
Yeah,
okay?
so April 15th, well, April 15th is Type 1 Diabetes Day. And it's a really powerful day also centered around education and awareness for type 1 diabetes. And it's something that I encourage people to talk about more. And as someone living with this chronic condition for really most of my life, but also who takes care of patients who live with this, I do feel very passionate about educating the public about type 1 diabetes and early screening.
It's also tax day, doctor. Could that make your diabetes go berserk?
It sure can. Sure can.
All right. Thanks so much. Appreciate you.
Thanks, Paul. Be
Take care.
well.